Hi, my name is Farah Abdi, second year nursing, third year nursing student. Today I'm going to demonstrate how to give constitute med and give out to minipack. So this is first of all, I've reviewed and compared doctor's order to the MA, and I went grab the right vial med. So now I'm going to do my first check after cleaning sanitizing my hand. So this is how I'm going to start. I'm going to compare the medication and whatever I have here. So medication doctor's order, and so the right patient, Ronald John Kite, date of birth 1955, it matches, and also field number 05494244, so they all match it. After I'm doing with that, okay, it says ceftazidime, this is ceftazidime, it comes in 1 gram, and it says 1 gram every 8 hours, and it was signed by two, the doctor has already signed this. And so after I'm done with that, so I'll compare the vial with adult PDM. So it says it's also antibiotic. So ceftazidime, it says it can be administered by a nurse or a student nurse. And also usually maximum single dose is 2 grams and maximum daily dose is, so we already have 1 gram here, so we below which one is good. It says 1 gram vial, which is, it comes 1 vial, add 10 ml stir water, and then the final concentration will be 10.6 ml. So, and also it says you can dilute with 10 to 100 ml D5W or normal saline, administer over 20 to 60 minutes. And also here it says it's compatible with D5W, normal saline, and which one our primary infusion, it's a normal saline running 125 ml per hour, so which they're compatible. And also potential hazard says patient might feel allergic to feel a rash or pruritus or pain through the IV line. So I'll keep that noted so that I can let my patient know. So now I'm going to reconstruct the med. So it says 1 gram, so add 10 ml of stir water to get a final 6. So I'm going to add my I'm going to reconstitute it. So I have to wash, basically wash, clean my hands, make sure that swap, use it for 30 seconds to 15, but make sure that I don't touch. Grab appropriate syringe and needle, and also sure that I don't touch. So I need 10 ml, so I'll just 10 ml air. Make sure that I don't touch it. Then I take sure that I have my 10 ml. So there's a small bubble air anyway, so you can see that's 10 ml. And then I haven't touched, so I'm going to reconstitute, add my 10 ml here, just gently so that it can dispersely create a space. So I'll make sure that I use scoop method, make sure I gently mix it. And the final concentration will be 10.6 ml, which after my calculation here, that's how much I need to withdraw. So it's 95 ml per 95 ml per milligram per ml, and the doctor order was at 1 gram, which I converted into milligrams, so it was 1,000. So anyway, after making sure that I mix it, I also have to clean it in case I touch. So up again for 30 seconds and dry it, let it dry. But for the sake of the video, so I need 10.6 anyway now. So I'll just make sure that there's no air bubble. Use a scoop method. Okay, so I just leave it here. So before I just reconstitute, so I'm going to use normal saline, 100 ml, just to reconstitute it. Before I go to that step, so first of all, I'll do my second check, just to make sure that I have the right information and the right dosage. So again, I'll do my second step, drug check, second med check, and this is how I'm going to do it. So I have the right patient and also created a label so that I don't do it wrongly. So right patient, Ronald John, and then right dose would be, so it will be 1 gram divided by, according to my calculation. So I have 10.5 ml. So the right time, it switches after every 8 hours, which was given last 8 hours. So I'm going to administer it now. So right route will be IV, it's going to be IV. Right time, I already said. So after making sure that I've compared, I did my second check. I'll reconstitute and add on my, I'm still on my mini bag. So if I do that, I'll just clear it again so that I don't contaminate for 15 seconds, 30 seconds, and 15 let it dry. But for the sake of the video, I just add it. This goes to the sharp container. I'll just okay, now I'll gently mix it and make sure that my mini bag it's on date and it doesn't have it's intact and all is good. So just to correct myself too, even on my vial, before I did that, I was supposed to check the expiry and also intact. So now I'll label it. I already created a label. I'll just label my mini bag. So okay, so now I'm going to the patient room just to make sure that I go with my staff supply. So first of all, before I'll do just a safety check. Safety check will be like, you know, if patient is distressed or anything, any hazard. And then I'll go with my mark sheet and compare. Hi, my name is Farah Abdi, third-year nursing student. Today I'm going to give you antibiotic medication. So I'll just ask him for first name and last name while double checking his wristband, and also I'll check the IV site and look at the everything is running accordingly, just to make sure that, you know, everything is not, there's no king, there's no any. So now I'll use this opportunity as to introduce myself and also know my patient know that the reason why he's taking this medication. It's Ronald John. Doctor has prescribed this medication for you because you have a lower respiratory tract infection and it will help you. You might feel a reaction. And also, you might feel like that. You might feel like you like sign of allergy or anything. But if you feel any kind of those symptoms, let me know so that we can deal with it accordingly. So after that, I'm done, and also I'll give him a chance. He has a right to refuse in case he doesn't want to take it. So I let him know that, and now he's okay. He wants to take it. So first of all, then make sure that before I do anything, so I'll let him know that give me 2 minutes. Let me check my third. I'll compare my med. I'll do my third med check. So I have the right patient, Ronald. I have right med, which is cefosadim, and right route will be IV, and right time will be now, which will be after every 8 hours. So I'll set my tubing, my IV secondary. So first of all, what I will do is I'll just adjust this one, lower this one, so that I can set it up. That before touching, I have to make sure that spike it. So I'll just swap for the sake of I don't have alcohol, but I will do like clean it. I mean without touching it. So this will already be used, but I'm doing second time, so just to make sure. And then without putting it down and not touching, I'll just spike it, and then also make sure that this is closed, so that and then so also I need another alcohol swab, just to make sure that put above there. I'll just put it here above the pump, so that I don't touch it, and make sure that it's so this is already set. So I did my calculation, just a minute. I did my calculation, and this is my calculation. So it's 101 point, it's 110 divided by, I'm going to run at 60, so it will be, I'm going to run 100, so this is my calculation, 111 per hour, so that's my calculation. So I'll just set the secondary. First of all, I'll stop the primary. I'll stop the primary, which stop, and then secondary, it's already, you can 110 over 110, and then I'll say start, you see, and then I'll say start. So just ignore that. So before I leave the room, I'll just educate the patient, make sure that the bed is lower side, and also make sure that the IV or anything, it's all lines are open up, everything is running smooth. And I'll come back in an hour just to check on the patient. And the reason, just to correct myself, the reason why I selected, it says on the PDM that drug monograph that I can give within 20 to 60. So the reason why I choose 60, this drug, this is his first time, and he might feel a reaction if I give him in a short span. So the reason why. So I'll educate the patient, and also let them know I'll be back. The bed is within the reach, and also I'll come to check if this primary has to kick it in, so that I can program 15 ml to 15 cc to just flush, so that the patient, and also I'll record the time, and the thing is like yeah, so the thing is like, yeah, so yeah, and that's all.